you gave all the risk factors. Just say you're a patient or someone who's at home and you don't have a lot of risk factors. You're starting to feel some chest pain or signs that you're not sure, am I having a heart attack? What should you do? What kind of signs would you have, and what would you recommend for someone at home to do at that point?
That's a very good question. Most patients will describe a feeling of tightness or heaviness in their chest, or even a sharp pain, or typically when they're having a heart attack, as if an elephant was standing on their chest. I mean, it's rather unmistakable when it happens. However, it's become very apparent that women have very atypical symptoms. They can have sharp pain, feeling of shortness of breath, a sense that they're perhaps having indigestion, and all these atypical features may delay presentation to the emergency room or to a doctor's office. I think the most important thing, as is true in most diseases, the earlier you diagnose the problem, the better the long-term outcome is. And so it's incumbent upon the patient not to take the symptoms lightly, but to seek medical attention as soon as possible. And there are certain very simple blood tests, an electrocardiogram performed, as well as a physical examination, which can largely determine whether this is a heart-related problem that's at least a workup and evaluation in the future. I think once the diagnosis of coronary artery disease is made, the next step is really a hospital-based procedure, which is coronary arteriography. And Dr. Kumar is an expert in performing these procedures, and maybe he can describe it.
Thank you very much, Dr. Weiss. And we talked about two different scenarios so far. And one is an elective setting that if somebody is having chest pains and family history of having coronary artery disease, and now they go through non-invasive testing and they are found to have some problems, and they come to me to check whether really they have these coronary artery disease or not. That is one setting. And the other one is the most important setting that people try to ignore, as Dr. Weiss just mentioned, that if somebody has chest pain at home and or epigastric discomfort or something burning sensation, and they may ignore and say that it is maybe a heartburn, maybe it is not coming from the heart, and they waste most of their time at home not coming to the hospital. What I believe is the earlier that you come to the hospital, the better you'll be served. And I think if you wait for 5 minutes and if you do whatever you want to do to relieve that pain, and if the pain does not go away, it's better that you come to the hospital. So why am I saying that is the time saves the heart muscle. The more time that you waste, we are wasting and we are damaging more heart muscle. So once you come to the hospital, and there are simple tests that they can do, and they can identify if you have a blockage or not, that means that you're having a heart attack or not. And once we find that you're having an acute heart attack, it's a totally a different thing. You have to be cared immediately. That means either by giving a medication, a clot buster to relieve that blockage, or clot buster to get rid of that thrombus, that clot sitting there in the arteries, or by opening the artery by primary angioplasty. That means passing a wire through the blockage and then opening with a balloon and putting a stent. And we can provide the better flow to the heart right away. And we are proud to say, under the supervision of Dr. Weiss, Westchester Medical Center has been providing that kind of care 24/7 for the past 15 to 17 years. And we do more primary angioplasties and weekend services and night services than anywhere in New York area. And that for that I'm saying that we are proud to provide that kind of service, almost like best in the country. Going to a hospital is the most important thing. And if you have a choice, I want you to go to the hospital where they can provide the emergency cardiac services. Absolutely true. Another thing I want to tell you is thrombolysis with a medication by IV is not a bad choice at all if you have no choice, because there is an 80 to 60% chance that the thrombolysis does work. That means instead of doing nothing, not going to any place, if you have the thrombolysis, that is the best option. But the superior option is primary angioplasty, because we can open the artery 95% to 99%, and we can provide the blood supply to the heart.
My question is, once it's open, what type of therapy do the patients need to continue doing from that point? And how important is the medication?
It's very important. Let me put it to you that way. We know from the literature on stents that if you're not on certain medicines that are platelet inhibitors, like aspirin and Plavix, that there is a risk of developing an acute thrombus or a blood clot on the stent. We also know that there are certain medicines that help you live longer and prevent further heart attacks. So many times, once Dr. Kumar has done his work, we need to continue to care for the patient. It's not right to say, okay, we fixed the plumbing, you're done, it's over with. Two major things go on from that point. One is the medical therapy, and the second is to continue to risk modify the patient. And we're going to talk a little bit today about maintaining a healthy heart, preventing coronary disease, and once you have coronary disease, to try to prevent it from ever coming back again. So again, Dr. Weiss talked about modifying the risk factors, the major risk factors, maintaining an ideal weight, exercising, diet, all extremely important. Not smoking. If you're diabetic, controlling your glucose. And very, very important, cholesterol. We really haven't talked much about cholesterol yet. But again, the diet and certain medicines to lower your cholesterol is important to prevent these blockages from coming back. So the platelets, or the cells in your body that causes the blood clots, we want to inhibit them. So we use aspirin and Plavix. Aspirin we usually use indefinitely, but the combination of aspirin and Plavix we use for 9 months to a year, and sometimes indefinitely. Depends on the patient. But most studies have shown there's a significant benefit to being on those two antiplatelet agents for at least 9 months to a year. Beta blockers are other medications that have been shown to be very important in preventing heart attacks, living longer. There are things called ACE inhibitors that we put people on, again, to remodel sometimes ventricles that were damaged, and to help prevent heart attacks and help people live longer. And finally, the statins, or the therapy that we use for cholesterol, to lower the cholesterol. And some people don't know it has other properties too, anti-inflammatory properties, properties that really benefit a coronary artery. So it's extremely important that once you've had your stent put in, once you've had your heart attack, that you follow up with your cardiologist, that you make sure you're maintained on your medication, and your risk modification, those risk factors, changing them is of utmost importance, in my mind at least.
Talking about a healthy heart, I just want to touch on valves, because a lot of patients, a lot of people out there have been told that they have a leaky valve. What kind of care should someone who's been told that they have a leaky valve and are worried about it, what should they do?
The heart is a pumping organ that is really a very specialized muscle that pumps blood around the body. As such, it has 4 valves, which are one-way valves. They're not supposed to be leaking backwards through those valves. The valves can get damaged in a variety of ways, from infection, rheumatic fever, born with an abnormal valve, and it's often progressive in nature as time goes on. What could be done about this? Well, that varies according to the cause of it. But in general, we have to watch the patient very carefully, control blood pressure. We can monitor the progression of disease, if at all, with very simple ultrasound examinations called an echocardiogram. And we have to certainly be careful that the patient does not get endocarditis or infection on the valve, which can be prevented by using antibiotics before certain procedures, or even just